Hi, I'm Dr. Jerry Hesch, a physical therapist from Hesch Institute in Aurora, Colorado. And this is a demonstration of self-mobilization of the T1-T2 and C7-T1 articulations. Note that the clavicle articulates, of course, with manubrium, but it also articulates with the front and upper side of the first rib. And so we can take advantage of that relationship by fully flexing the shoulders, which then will pull the clavicle laterally, which will also pull the first rib anterior and laterally. And of course the first rib articulates with the vertebral body of T1, and it also has a long articulation with the transverse process of T1. And so by gapping those articulations, then T1 has greater freedom of mobility. And so I'll lay down on the table here and demonstrate how that works. So it's good to scoot up to the edge of the table or edge of the bed. If they're doing it at home, they can lay sideways on their bed. And they bring their shoulders closely in and go to end range of shoulder flexion. And it's nice to stretch that for about 30 seconds. After which we'll continue that stretch, but we'll introduce some gentle neck and upper thoracic movement. So now I'm gliding my neck left and right. And I recommend at least 10 reps each direction. And then I'm introducing side bending, left and right. And then right and left rotation. And then you can add gentle chin tucks. And then you scoot up so your head is off the table. And then you introduce posterior glide of the cervical spine. And I was blessed to have a restricted upper thoracic segment that responded very, very nicely to this self-treatment. Now you can also lay at an angle off the treatment table or scoot up high enough that you allow your arms to follow the angle of the clavicle, and so you're doing horizontal abduction, and that creates a nice lateral traction to the first rib and allows greater freedom of T1. So you can repeat those exercises with the shoulders horizontally abducted at about 110 degrees in line with the angle of the clavicle. And then the last self-treatment that you can utilize uses a fulcrum. And I like this piece of foam. It's open cell foam, so it gives a little bit and then becomes firm. And this is cut off of a 4-inch round foam. I just cut the bottom of it so it has a flat surface, and then I do an angle cut at about a 30-degree angle, leave it at least an inch width, and I find that very helpful. But another option to that would be to do a ball, and this is called sponge baseball, so it gives a little bit. It's not a hard ball, okay? Or you could use one of those rubber balls that's about 2.5-inch diameter that you can buy at almost, Walmart or Dick's Sporting Good or Target or Walgreens. Any of those stores should have one. It should yield a little bit for comfort. And given the upper curve of the thoracic spine, it's a little tricky to get right on the spinous process of T1, but it helps if your head is off the table and you place that in the midline And then you, I especially find it helpful to introduce posterior glide. And of course you do that with the arms, the shoulders in full flexion. And the posterior glide of the head greatly enhances anterior glide and extension. And we know that over time we often develop a flexion pattern at the cervicothoracic junction, and so this counters that quite nicely. And in addition to posterior glide, you can also do rotation, you can also do side bending, and you can also do side glide and chin tucks. And you can also do extension. And for the general public, please don't do this unless you have guidance of your healthcare practitioner. This is for information purposes only. Thank you very much.